morning and welcome to Health and Wellness with Susan. Susan Williams, owner of Back to Home Healthcare Agency. Today I'm joined by an amazing colleague, Pedro Martinez, Regional Director of Pulmonary Rehab and Consultant for Respiratory Solutions. Today's topic is preventing common respiratory illnesses. Thank you, Pedro, for joining us. Can you tell us a little bit about what you do?
Thank you for having me, and also want to thank God for this wonderful opportunity here. My name, for those that don't know me, my name is Pedro Martinez. I've been in the healthcare field for about 30 years. I've been a respiratory therapist for 23 years, and I worked in various areas in the respiratory field, starting in the acute care arena, and then finally now I'm working in the long-term care arena.
Wow, very impressive. So before we start, I want to extend a happy Respiratory Care Week.
Thank you.
So Pedro, with the impeding respiratory illness that's going out, we're pertaining to the coronavirus. We want to talk about some of the common signs of the cold, okay? So I just wanted to know if you could share with the audience, what are some of the common signs of colds that they should be looking out for?
Certainly. So one of the most common signs for the common cold is obviously sneezing, coughing. On a more serious side is that you can have a temperature, start off with a low-grade temperature of, say, 99 and 100. You also have issues like sore throat, runny noses, headaches, and things of that nature.
Okay. So I know you get this question often. Some people believe they have the flu. What is a sign or symptom that you may be able to determine you have the flu versus a cold?
Well, what we've seen is that the flu is more of a serious, even though they both appear very similar, the flu is more of a serious disease. When you have the flu, obviously you're going to have a lot more of the similar symptoms as a cold, but more in a severity case. For example, you might have a higher temperature, things of that nature. So it's a little bit more serious.
Okay. So our audience can understand. Can you explain like the signs and symptoms of pneumonia? I know a lot of times we go to the doctor and the physician gives us this diagnosis of pneumonia. We think it's the end of life. If you could just explain to our audience what pneumonia really is, what are the signs and symptoms, and some of the treatments that you guys offer.
Sure. So pneumonia is an inflammatory infection of the alveoli. So pretty much it means that your lungs are inflamed or can have some kind of a fluid like in the alveolar sacs. Okay. A lot of the signs and symptoms that we've seen is obviously being an infection is fatigue, oxygen deficiency, obviously fevers, chills and sweats, and coughing in most cases.
Okay. And how long does pneumonia last? What do you see as far as the physician prescribing medication? Is it a 7-day? Is it a 10-day course?
Well, it all depends. Just like everything else, if we catch it early, we'll be able to eliminate that infection early. What we've noticed is usually a 10 to 14-day course of going on antibiotics, and the antibiotics could be anything from erythromycin to Levaquin. Being in the more stronger side of the antibiotic. So it usually ranges from a 10 to 14-day period.
And I'm sure that the patient possibly had an x-ray. Do you recommend them having a second x-ray to verify that the pneumonia is gone?
Certainly. Actually, we recommend 2 x-rays. We do an x-ray early onset to make sure that the patient has a pneumonia, because that's how we're able to tell. And then after, maybe a week after the antibiotics, whether it's a 10-day or a 14-day course, we recommend to have another x-ray just to make sure that the pneumonia has cleared out in the lungs.
Okay. So share with our audience some of the things that they can do to stay healthy. You know, I'm a fitness guru, healthy eating, but can you share some other things that they can do to stay healthy, especially during this corona pandemic?
Certainly. I think one of the key things to stay healthy is, number one, maintain social distancing, with everything else that's going on in the world. Eat right. Monitor your health. If you feel a little odd, a little weary, check your temperature, and things like that. Just keep an overall awareness of yourself and how you feel. Certainly, if you go out to the public, wear your mask. Very important. I can't stress that enough. Another key thing is that if you are not feeling good, you're not feeling well, you're not up to par, you're under the weather, stay home. Okay, stay home. Monitor your signs and symptoms. And if something does show, like say you have a low-grade temperature, don't be hesitant to reach out to your physician, or to call your nurse practitioner or whoever it may be, that's caring for you. Don't be hesitant to do that, because you want to take care of this thing early. You don't want any common respiratory illnesses to just go by.
Okay, so we had a question from our audience. One of the questions is that what happens if the antibiotics does not take effect? What is the next course of treatment, meaning for the pneumonia, when you mentioned about the 10 to 14-day antibiotic?
So usually when when you get antibiotics and it's not working, okay, I think depending on what setting, say you're home and you're sent with antibiotics, that's the time that you need to call your physician. Now, remember, you have to give it time. These things don't kick in right away. So you have to give it some time. But if you still feel that after you gave it some time, your antibiotics are still not working, then you should reach out to your physician, okay, tell him that. And then mostly what they'll do is that they'll either give you another type of antibiotic.
Okay, we have another question. Has it been misdiagnosed with a respiratory infection versus the coronavirus? We see this often, though.
Well, they both seem very similar. I mean, they could be misdiagnosis, but, you want to make sure that whatever it is that you do have, there's tests out there that we can do. For the coronavirus, there's certainly a test out there that we can do. And there's two kinds. There's one that usually appear, that you can get tested for, and you get the result in about 48 hours. And there's a rapid one, which is pretty much done in the hospital setting, where you can get the test within 20 minutes to a half an hour. So, and that's how we're able to differentiate, what it is that you may have.
Okay. Pedro, in closing, do you have any other advice for our audience? Especially, let's just target our elderly population.
So for the elderly population, my recommendations would be is to wear your mask. For the general population is get a flu shot. For the elderly population, also please get yourself a flu shot. And if you can't, get yourself a pneumococcal shot, a pneumonia vaccine. I think, as we get older, we don't have that same immune system that the younger population has. So I think in turn, it's always good to protect ourselves in every which way that we can. And I think by getting those two vaccines are kind of really going to help us. Wash your hands. If you're going to go out to the public, wear your mask, and just be mindful of your social distancing.
Okay, so we have one more question, Pedro. I know we went over it a little bit, but we have other people joining in now. The question is state the possible symptoms between the two. And I'm assuming that they're talking about the coronavirus versus the flu, which we know as respiratory care practitioners that they're very, very similar, except for the fact that the testing is going to differentiate whether or not you have coronavirus versus the flu.
Correct.
Do you agree?
Yes, I do agree. And they are very similar, except that when you have the coronavirus, and it affects different people in different ways. Um, but when you have the coronavirus, again, it's a more serious type
Correct.
of sign and symptoms. I mean, you can
Okay.
get, shortness of breath very quickly. You can get, temperatures as high as 104, 105. So
Wow.
it's a much more serious um, 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 virus, so to speak.
Correct. Okay. Um, so I want to just send a definitely shout out to Desiree Jefferson. She says, thank you, sis, so much good information. She got the flu shot. Gloria Dono is saying, thank you, great show, well done. Yvette Atkins was the one who asked the first question in regards to what occurs after the 10 to 14 days of taking antibiotics. And I believe we had someone else, my Celia Renrick, who asked what was the difference between the two. And I think that's just a common question about what is the flu versus what is actually the coronavirus as we continue to learn more about this virus, of course. Yvette says that she got her flu shot, and that's what we want to do. We want to encourage you to get the flu shot. We want to encourage you to definitely get the coronavirus swab. Even though we know that it can be a little intense, we want to make sure that you're healthy and you're safe. And also the biggest thing too is to make sure that we're looking out for our elderly population. They're so vulnerable during this program. I mean, during this pandemic. So you've heard it from our own Pedro Martinez. I want to thank you again for joining Back to Home Healthcare Health and Wellness Forum. Thank you for joining. I want to thank the audience that came in and asked some amazing, great questions. And we look forward to having this forum again soon. Thank you again.
Thank you, and thank everybody out there, and everybody out there be safe.
Thank you.